And today we're talking about exercise is medicine with our very own Marissa Gibson Bailey, sport and exercise scientist, exercise physiologist. Good morning. Good morning.
Good
Good morning.
morning. Good morning, Lisa. Good morning, Rokas. Hi, Ayanka.
So I am jumping right out and say congratulations to you because you've been
Thank you.
selected as one of the guest speakers for BASIS 2021. That's a big deal. Just very quickly
It
before we start
is.
talking about it, yes, give a round of applause. That is
Thank
huge.
you.
Tell us why.
It is.
Tell us what it's about.
Um, well, BASIS 2021 Students Conference is really under the banner of equality, diversity, and overcoming adversity. So you have a barrage of experts, leaders in their field, talking from biomechanics to sport performance, psychology, nutrition. They focus on sport medicine, rehab, mental health, as we spoke last time, mindfulness. When you look at the speakers, I was like, I could not believe I'm amongst
And why
giants.
not?
Like
And why
really.
not, Marissa Gibson Bailey? Well
No,
deserved.
it's just actually it is the biggest what to call it, conference for sports science
In the
students
world,
at
right?
graduate, postgraduate level. So yes, in the world. So it's like really amazing. I'm excited, but scared at the same time,
No, go
but
represent
I'm
Trinidad and
looking.
Tobago, girl, as
Yes,
you can
yes,
and as
yes,
you've been
yes,
doing, because you're a credentialed global advocate in this
yes, I
region
am.
for,
Yes.
tell us what?
For the Exercise is Medicine, which is a global health initiative by the American College of Sports Medicine. They're actually in 40 different countries across the world. They have teamed up with the American Medical Association, where there's a vision actually to have physical activity assessment and promotion of physical activity as a standard in clinical care. Now, this is really crucial, especially with this COVID-19 situation where physical activity is starting to prove to help boost immunity. I
Yeah.
listened to the interview with Dr. Wheeler this morning, and she spoke keenly about immunity. And I think having physical activity as one of your intervention measures is very key during this time, because when you take the vaccine, it helps to boost that immunity, that combination. I think medical practitioners will be able to explain that even further,
Yeah.
how when physical activity or exercise in itself affects T cells, right? The immune cells as well. So there's a good combination there, and it's a very good approach. I think we should have in our back pockets as the way how we deal with the new variant, as well as the normal COVID-19
Yeah.
issue.
Marissa, what does it mean to be credentialed in this initiative, Exercise is Medicine?
It means that the American College of Sport Medicine recognizes the qualified exercise professionals that could work with clinical population. So you must have that clinical expertise as well. What they also would want to take into consideration also is that education of professionals that could effectively can be referred from medical practitioners. So for example, it's more like an extension from the healthcare. So once if your medical practitioner refers the patient to you, you should be able to work with these patients. That's why you have to go through your rigorous training,
Yeah.
and not just only work in the sport setting, which is different from the clinical setting. You have to also be trained in that area as well.
And why do you support and advocate for this?
For the very same reason of there's, as us, there are a lot of scientific research that speaks to exercise and the benefits of exercise and physical activity. I am advocating for persons to become active because it has that effect. It has that, you talk about the same mobilizing immune cells. You talk about the financial return on lifestyle interventions, which is long term. It could be 3 to 5 years or 5 to 10 years. You talk about disease management. We more look at, how to say, we don't look at prevention, we more look at disease management. And I think that with this initiative, we're looking at more prevention.
Yeah.
I think this is something that we need to consider within our healthcare as well, and we need to incorporate qualified exercise professionals as an extension to our healthcare. So we look more in the communities. If you could spread them across the communities in those lovely health centers that you have with exercise machinery,
because you
they
have
work
them in the
along with the
communities
medical,
already, yeah. In the parks, you
right?
have
And
the
you work with the medical team. Then you could be able to have proper research evidence-based physical activity programs that has results for these different areas, and it could work. It could work, because then we could now focus on promoting healthy behaviors in a more effective way and directly affect our healthcare bill.
Well, that's a good way to wrap it up, and also to say
Yes.
congratulations once again, Marissa.
Thank
Go
you.
represent
Thank
us
you.
at Basis 2021, and you do that so well. That was Marissa
Thank
Gibson
you.
Bailey, their Playground to Podium, a regular segment. Right now, though, we got to kick it upstairs